So basically the nail changes color. It might have a bad smell. It can get thicker and cause the nail to grow curved and lift off and get very painful. I'm Dr. Melody Chong, a podiatrist. I treat ankle, foot, and some leg issues. And I'm located at 3838 California Street. And I've been in practice over 25 years. Another very common problem is fungus in the nail, and basically it gets between the nail and under the nail, causing the nail to get thicker, grow abnormally, including a curved or what we call ingrown toenail. So basically the nail changes color. It might have a bad smell. Again, it can get thicker and cause the nail to grow curved and lift off and get very painful. So how does the nail get this way? Usually it's from damage from injury, and that includes poor shoes causing pressure onto the nail, and also it's very common in those who are older and in those with health problems like diabetes, anybody with poor circulation, athlete's foot, and sweaty feet. Those are very common causes of the nail getting kind of odd looking, or patients say they look kind of funky. Well, usually patients come in because they don't like the way it looks. They want it taken care of. Also, a very practical reason is for me to provide them pain relief, because sometimes the fungus toenails, like I mentioned, can get painful and curved. And then if you just leave the nails and if you don't do any treatment, what can happen? Like I mentioned, you can get pain if you don't have any pain, and you might get redness from the toenail itself because it's pushing up on the underlying toe. Also, you can get redness at the end of the bone underneath the toe. It also decreases the chance of getting another kind of an infection, such as a bacterial infection, and it can prevent the nail from getting injured, meaning it can prevent the nail from just falling off or getting pulled off. So those are important reasons to get it treated. And it should be treated in patients with diabetes, patients with a nerve condition. They often have no feeling in the feet. Also patients with poor circulation. This is to prevent more other problems, like I said, like a bacterial infection or further injury. So the main way to treat this is that of shortening the nails and thinning them. Also, there are medications that one can either apply to the nail or take by mouth. This is treated to prevent the spreading of the fungus to the other nails, if not all the nails have fungus in them. Some other treatments also include temporarily removing the nail or permanently removing the nail. Here's some diagrams of toenail fungus. It is very challenging to get rid of, so this is just over some time. And then here's the next one. It just takes it's a long process. Please click over here to watch the next video on foot care. Do you have a solution for your foot problems? Comment on this video and please let me know. Thank you.